welcome to another episode where we get to meet amazing people doing great changes in the world. And I'm your host, Jennifer, and I'm so excited to be able to introduce you to another amazing guest speaker. Now we're going to meet an extraordinary doctor who has made it his mission to help other healthcare professionals around the globe and frontline support workers. Let's now introduce you to Dr. Hamid Elmyar. I'm so excited to have you here today. Doctor, how are you doing?
Good, great. Thank you, Jennifer, for having me on here, and really happy to be here and chat with you.
Through your journey going through this huge COVID crisis that's been so spread, what words of advice could you share for people that are going through these huge changes? I'm sure you've learned a lot and there's lots of wisdom there. Yeah.
Thank you, appreciate that. So I would say that life in general is sometimes, very stressful, regardless of what profession you are in, what job do you do, what part of the world you live in. It has its up and downs, and especially during this pandemic time, it's a really challenging time for all, people across the world, especially here in the U.S. also with people who work from home, people who are, who have unfortunately lost their jobs, and people who are trying to, working in the front lines with the challenge and stress, making sure that they, just bring the bacon home, basically. And that's very my advice at this point for everyone who listens to this is that is actually three things. One, you have to be aware, and by aware I mean get your knowledge and information about this health, especially about this pandemic and COVID-19, from reliable sources. By reliable sources I mean, those of course the local health departments, your physicians, your other healthcare providers who in social media, and of course the CDC website. Johns Hopkins has also sorry, a very informative website, and wherever your audience is in the world, they can also go to those reliable sources in their own countries to find information that can help them. That is awareness, and this is really important because in this time of social media, a lot of information is just being transferred and copied and pasted on social media, which could be unreliable, and misinformation that actually would be very at least I would say that it cannot be helpful if not harmful. But and then the second thing is be responsible for yourself and responsible for others. By that I mean that when we abide by the public health directives, and when we do social distancing and all other information that is being you know conveyed the message across the world, and here in the US, in Canada, in different parts of the world, through health um, you know uh, professionals and public health directives, abide by those rules, and during this hard time we all together can make it through. And that's when you are, if especially the younger generation, if they are healthy, it doesn't mean that they're not responsible. They are responsible for their parents, they're responsible for their communities, they're responsible for their elderly people in that they face on a daily basis. That they could be it could be a challenge for them if these younger generations are you know immune wise healthier, but they would put elderly people's lives at risk if they don't abide by the public health directives. So that's the second one, to be responsible for yourself and for others. And the third one, and perhaps the important one, is not to over panic. This is a tough situation. It's hard from different angles. But again, panicking really doesn't help. Over panic, especially because as your main topic, stress, and if people start stressing a lot, and clinically stress increases the level of cortisol, and then cortisol can increase high blood pressure, heart disease, that all other consequences can happen. And that's why, and again, it goes back to the very first one: be aware. If you get your information from reliable sources, then you indirectly decrease the level of stress, because you don't panic too much if you know what is the truth there. So don't get your information from unreliable sources. If I want to sum up again, it would be aware, get your information from reliable sources, and be responsible for yourself and others, and do not over panic.
Great words of wisdom. Extra tips for caregivers and support workers and health caregivers, because they're already dealing with like that added layer of stress. And I'm also thinking of compassion fatigue, that maybe we can speak to that a little bit in terms of how to take care of that.
Right. Thank you for bringing this question. Recently, I had also a panel discussion that was on burnout among healthcare providers.
Yeah.
And as someone myself, I work, full time in the front line, and it is difficult time for all of us. Especially, I've been talking with physicians from different specialties, from ER to their private practices. It's a challenging time, and and burnout in the healthcare industry is a silent epidemic or a hidden epidemic. Unfortunately, it is directly attached to a negative connotation, and like a lot of when we talk about burnout, which is by definition just an occupational phenomenon. It's not a disease, and but it is, now prevalent more than ever in different professions, not only in health industry. But we have to recognize that we have to set some time for ourselves, and especially healthcare providers, to make sure that your health is also important. As we always hear and listen when we travel on the airplanes, they always tell us to put the mask on ourselves first. Use it yourself. You save your life first. And this is not something that, of course, as health practitioners, we always dedicate our time, energy, and resources to help our patients, and that stays, as strong commitment as it is. But again, during this time, we also have to be mindful of our own health. My podcast is another source of, way that they can learn more about what is going on in the health industry, especially during this time.
Just to reiterate, so if you want to reach you for more information and keep current on what's going on in terms of the crisis and how we're kind of handling this whole thing in the world, we can reach you again. Let's just repeat that, so in case people miss that. Your podcast, which is?
My podcast is called With Dr. E. And so if they search under Dr. E, there could be probably many other Dr. E's, but mine is With Dr. E, WITH, and Dr.E, the letter E. And they can find more information there.
Again, as you said earlier, it's all about community and being able to help grow this mission of helping our children, our families, our communities, and heal the world.
Absolutely.
And I just want to say thank you so much for sharing your time, your expertise.
Pleasure to be here with you today, and thank you so much for all you do